warm welcome to you from Geneva, Switzerland. This is Reda from the Geneva Learning Foundation. I'm here with Marta-Gacic Dobo from the World Health Organization Immunization, Vaccines and Biologicals Department. Welcome, Marta. How are you doing?
Thank you. Good afternoon, good morning, everyone. And thanks for the invite.
Great.
I am happy to be with you.
So today is this is a 15-minute, what we call a lightning chat. So it really is a short session. We invite you, though, even if you just happen to be looking at your Facebook notifications and now you're here, stay with us. We're going to be asking Marta questions about the Immunization Agenda 2030, the new strategy for the coming decade for immunization, and specifically the data component. Why data is so important to this new strategy. Marta-Gacic Dobo is the manager of the Strategic Information Group for the expanded program on immunization at WHO. Charlotte, you are, let's see if we can get Charlotte here. Yes. All right. Charlotte, how are you this afternoon?
I'm good, Reda, and welcome to you, Marta. Good morning, afternoon, evening to everyone that's joining us for today's lightning chat.
Great. And so there's a number of scholars, including the ones who we see in every event that we do on Facebook, such as Dr. Ndayo Iwat from Nigeria. I'd like to ask you if you could also say the city and country that you are from. Tina says, welcome, Marta. Nabil Fahad from the Comoros Islands says hello as well. Rajat Garg from India. Ahmed El Nagar from KSA, and Mohammed Taimur from Pakistan. So quite an international event that we have. We're going to dive right in with Marta. So let me, and we're going to first ask you, Marta, can you tell us what you do at the headquarters of the World Health Organization and how your work makes a difference for immunization?
As I said, as Reda introduced me, I work in World Health Organization in the immunization program, and I am leading a team on global monitoring, this strategic information group. And the way how I can explain the work we are doing is probably twofold. So the one, as one of the WHO's mandate to monitor and provide health statistics. So we are in charge for monitoring the immunization programs, which includes monitoring in terms of the vaccine preventable disease surveillance data, the immunization coverage data, information on immunization program performances, immunization schedules, and so on. And we do that with all the countries, with all the 194 member states from WHO, and then we consolidate, analyze, and disseminate that information to fulfill our mandate to provide statistics, health statistics, and information immunization programs. In addition to that, we also provide guidance to countries on their information immunization systems, on immunization registries, and also provide capacity building in training. And that's how you know some of my staff members, many of you, through this scholar program as well, to make sure that what we do here actually reaches down where it is more important at the country level, at the district, subnational level, and eventually down to the frontline health workers as well.
Great, thank you so much. We want to greet Ahmad Sanga, Marta Ngoe, Edwin Dogubo, Subhash Ridas, and Abdul Sami Khan, who have also joined this Facebook Live session. And in fact, we're having this lightning chat with you, Marta, because last week we spoke with Kirsten Gagnier, who's contributing to the work of the IA 2030 Data Strategy Working Group. There were many questions about IA 2030 in general, which we could not address last week, and this is not the point of this lightning chat either. But there's also a lot of interest in the data work, and we wanted to better understand WHO's role in the IA30 data strategy. So this is how we got here. A quick word, we cannot have ask you questions without asking you very briefly, what is changing for you due to the pandemic with respect to the critical work that you're doing at WHO?
So apart from as many of us to work under different circumstances, to work from home, it also means that we also have to branch out our work, because we all hope very much so that we will have a vaccine for COVID fairly soon, and we will have to then deploy that vaccine and make sure that the vaccine reaches where it's most needed. And this vaccine will be somewhat different in terms of, especially in the beginning, because that will not necessarily is going to be deployed for the infants, but we have been doing for many years very successfully. But we will have to make sure that we reach the population, the elderly population, also the population under high risk, and the health workers and the essential workers around the world. So it's a lot of preparation around that, and that keeps us all busy. In addition to that, we also may have to make sure that an essential health service such as immunization continues even towards the pandemic. And it's even more so important because we all know that in the beginning of the pandemic, when everything stopped, and in many countries, immunization programs were also quite a bit disturbed. And we cannot afford, in addition to the pandemic, to have a pandemic of vaccine preventable disease where we already know that we have a tool and we have a control for it. So to make sure that immunization programs are continuing, that children get vaccinated even under that circumstances as well. I think everyone in the immunization program is quite busy. Yes. And including us here at headquarters, to make sure that we provide guidance, and then we also try to monitor somewhat in what extent this interaction is happening, and what are the solutions to make sure that immunization programs are continuing.
Thank you. So for those of you just joining us, we're speaking with Marta-Gacic Dobo, who leads the data work within the immunization department at WHO headquarters. She's also, of course, very much involved in the development of Immunization Agenda 2030. We spoke about it in a lightning chat last week, and we're following up this week. We just wanted to know more about WHO's role. You can see here the strategic priorities for this new strategy that is intended to guide immunization work to achieve the global goals in the coming decade. And one of the key core principles you can see here is, in fact, the data-enabled principle of putting people in the center, led by countries, implemented through broad partnerships, and driven by data. Now, we'll be coming back. I'm sure you'll be hearing a lot more via the Immunization Scholar Program and this Facebook page about IA 2030. But right now, we're just focused on the data work. So we're looking forward to seeing your questions. Thank you so much for those of you who have greeted us. We're now looking for your questions about this work. And could you tell us, Marta, how are you involved in IA 2030? What is WHO's role? And then what is specifically your role on the data front?
So the Immunization Agenda 2030 is a global strategy for the upcoming decade around the immunization work worldwide. This is not the first strategy. Many of you are familiar with the Global Vaccine Action Plan. However, we know that in this changing world, we still haven't really managed to reach everyone everywhere. We still have equity issues with providing immunization services. And then as we move forward, we also know that there are vaccinations not only for infants, but around all over the life course. So we have to make sure that we really reach everyone everywhere. And we also have to make sure that all the partners around the immunization are aligned around one strategy. And that strategy is really firstly owned and driven by the countries, but all the partners are supporting towards the same strategy. And so WHO's role is to coordinate across the different partners and to make sure that we are all aligned and following the same strategy for the next decade. As you all seen, and as Reda already mentioned, one of the core from the four core principles, one is data guided. So what does it mean? It means that it's very important that everything what we do is evidence-based. It has data behind it, and then the data is really used not only for monitoring purposes, but for action. So to make sure that we are able to measure the impact what we are doing, but also to make sure that we can get into policy dialogues, and also to make sure that in a all level, from the global level down to the health facility level, or our programmatic decisions are driven and made by data.
Thank you, Marta. Rajat Garg has our first question. And actually, we've got two questions so far, are both about COVID, unsurprisingly. Tell me if you feel it's outside the scope of this conversation, and we'll refer people back to the WHO website. But Rajat's question, is there any data or estimate how many children missed their due doses due to COVID until now?
So I cannot really tell you an exact number, but we are really trying to follow up with the countries and trying to be able to compare and really encouraging countries to compare month by month their vaccination performance, how well they performed last year in the same period of time compared to this year, to be able to see how many children were really missed out the vaccination. It is some kind of modeling work ongoing to try to really quantify and try to come up with some estimates. But at this point, we don't really have a concrete number that we can say that up until now, we estimate that X% of the children missed out. Earlier in May, we estimated that about 80 million children were at risk, where in the countries, the immunization programs had some disturbance. But ever since, the situation improved a bit, and many countries actually restarted their immunization programs with the precautions what needed to be done for the COVID vaccination. So with the social distancing and using the masks and so on.
Great, thanks, Marta. So second question is also about COVID. And so we want to be crystal clear right now, there is no vaccine against coronavirus that has proven effective. There's a number of candidates. But his question is to ask, would COVID-19 be considered as part of vaccine preventable diseases? How would it be done once it is available, as it is part of VPD surveillance? Are there discussions already within WHO and with partners about these issues? What can you tell us at this stage, Marta?
So it is a great effort to come up with a vaccine as soon as possible, and there are already many candidate vaccines, and there are already clinical trials going on. And WHO, again, together with with all the partners, with the COVID Act Accelerator, is preparing for the vaccination as soon as the first vaccines are becoming available. And it's also a very big effort to make sure that these vaccines are equally distributed to everyone and will be made available not only for the high-income countries, but for all countries. And Gavi is playing a key role on that as well, to be able to facilitate the vaccination as well. A lot of discussions are going on vaccine readiness already with the countries, and then how will the vaccine will be distributed, and in the countries itself, how will that vaccine will reach the most, the highest risk population. And then eventually there is already a surveillance for COVID. Will it be, hopefully it will be vaccine preventable. Where will the surveillance lie the best place? It probably will be very closely linked with the influenza surveillance because of the similarities. But I think that we all hope that, yes, it will be a vaccine, and yes, it will be part of the immunization programs at one point. But I cannot really provide you with the exact date when it will happen. But a lot of preparation is ongoing around this.
Thank you, Marta. We're going to take one last question. This is from Sandeep Patil, and it is about Strategy 2030 in general. So we realize most of the questions, of course, people are discovering this new strategy. And then we'll have, to close this lightning chat, we'll have a final question from Charlotte Mbuh, who is with me, and Marta. So Sandeep's question, is there going to be a different Strategy 2030 for developed countries and developing countries? Is there sort of economic disparities become, between countries? Are they factored into Strategy 2030? And if so, how?
Yes, definitely it is. So when we talk about the Immunization Agenda 2030, this is a global strategy. So it's a very, very short document, just really laying out the global strategy. But then all our WHO regions, they develop their regional strategies, which are much more tailored around the countries in the certain regions. And then the countries per se should be in a center of their strategies. So countries then need to adopt the strategy and modify it according to their need. And it's very much so the strategy for everyone. So it's not only for developing countries, it should be for developing countries and developed countries as well. And countries should really tailor it according to their needs.
Thank you, Marta. So we'll go to Charlotte Mbuh for the last question in this lightning chat. Charlotte, over to you.
Thank you, Reda. I have just one question for you, Marta. How do we get immunization actors at the base, at the front line, to treat data differently, to get to use the data that they produce? Because most often they consider that data is meant for those at the higher hierarchical level that are able to take decisions. So is there is this issue addressed in the IA 2030 framework?
So it is addressed in the IA 2030 framework in the sense that it's a data-guided strategy, and it's very, very important that data is used in all levels. And so we really have to make sure that we make the data an enabler to the health worker. So the data, what they are collecting is somehow in a way that it is very useful for them, that it can actually facilitate their work. So if, for example, for the defaulter trackers, if the health worker realizes that if it is organized in a way, or if their data is either electronically entered or even the paper reporting forms are organized and designed in a way that it's very easy for the health workers to see exactly how to ease their own workload and how to do it better and quicker and more efficiently, then the data use became part of our work. And this really becomes useful for everyone and not only seen as an additional burden for a higher level. Let me just say a very, very simple example. A well completed immunization card of a child, this is one of the base for many, many additional aggregated data later, but it can be very helpful for the healthcare worker because can have a very good idea what immunization action is needed when the child is in front of the healthcare worker.
Great. Thank you, Marta. Thank you, Charlotte, for this question. So we are out of time. This is literally and figuratively a lightning chat. So thank you so much, Marta. This is what we're doing. The reason one of the reasons for inviting you to speak about the data component of IA 2030 is that right now we are running the COVID-19 Peer Hub, where the point is to connect immunization staff to each other, to take action, to keep vaccination going during the pandemic. Data has been consistently one of the main topics of discussion within the Peer Hub. We will be sharing some of these outcomes and some of what is happening with the hub in the coming weeks and months with you and and your colleagues at WHO. Once again, thank you for having joined this session, and look forward to continuing the dialogue with you and working to connect the global work with all of the levels of a system, so everyone can have a voice in shaping this new strategy. Thank you, Marta and Charlotte.
Thank you,
Reda.
And thank you everyone for a very thoughtful questions.